In Yemen, the children's cries get louder, and the medical supplies continue to dwindle. As the world's worst humanitarian crisis deepens, it's here, in a facility meant to ease suffering, where the anguish is so very apparent. This hospital is in the city of Hodeidah, home to one of the country's most vital ports. With mounting international pressure, Saudi Arabia began to allow some humanitarian aid to enter Yemen in the last week of November. But aid workers say the continuing Saudi-led blockade, which began in October in response to a missile fired by the Houthis towards Riyadh, is limiting supplies of fuel, food, and medicine. Doctors are worried.
There's a big shortage in medications and equipment, and also there's a lack of specialist doctors. That means we have to refer some urgent cases to Sana'a, and in most cases, they die on their way.
In a country experiencing the worst cholera outbreak on record, and where millions are on the verge of famine, hospital staff say they're also seeing cases of severe acute malnutrition, diphtheria, and more.
Most recently, we've noticed malaria. Cases of malaria have started appearing. We've also started seeing cases of dengue fever as well.
It's no wonder parents are having so much trouble comforting their children.
When he was sick, he had diarrhea continuously. In the end, it was due to malnutrition, and from then on, we've been here to give him emergency care.
Pharmacies sit nearly empty, and supply rooms like this one are close to bare. But it's hope for parents, children, patients, and doctors that may be hardest to find. Mohammed, Jamjoom, Jazeera.